Medical professionals of Reddit. When did you have to tell a patient, "I've seen it all before," to comfort them, but really you had never seen anything so bad or of that nature? 11 years ago, my then 11-year-old shattered both femurs and her hip. At the time, her orthopedic specialist was so reassuring and confident that we had no doubts about her recovery. A year later, we went back for a review, and he asked me if I'd like to see her trauma x-rays. Not having any idea of the reality, I said yes. What I saw looked like her leg bones had exploded. After my freaked out reaction, I commented on how cool and calm he was, and how certain he was that she would be fine. He said he'd actually had to go for a short walk around the hospital to collect his thoughts, since he had no idea how he would put this child back together. He also told me he had used the films as a teaching aid. He's one of my heroes.
We now have a Discord. Check out the server in the link in the description.
Story 2. A dog bit my little sister in the face, ripping through her mouth and cheek. It was at a soccer game. She crawled on top of a big dog called a borzoi. This startled it, and it rolled over and bit her in the face. This was the late 80s, smaller town. There were no pediatric surgeons available, no plastic surgeons, and she was in the ER with her face ripped open. Anyway, our general pediatrician, who is now my kid's pediatrician 30 years later, who only had graduated maybe 10 years prior, sewed her face back together. It was 30 stitches on the inside of her mouth and 30 or so on the outside. She had a massive scar down the whole side of her face. Anyway, fast forward 15 years, she grew normally, her face is fine, her smile is fine, no long-term damage. Apparently, a face is full of nerves and muscles, and that's why only plastic surgeons work on faces. Particularly with children, having nerve and muscle damage can make their faces grow crooked as they age. It is a highly specialized field, but in this case, there was nobody else, just a general pediatrician, and he managed to save her face, with no long-term nerve or muscle damage, or even scarring now that she's an adult. We found out 25 years later from our pediatrician's wife that he spent an hour or so crunching his old med school books in the seat of his Plymouth Reliant in the hospital parking lot, studying facial anatomy, nerves and cheek structure, etc. He walked into the hospital and performed a multiple-hour surgery on her face. Sewed it back together perfectly. You would think a plastic surgeon did it. His wife told us he came home that night, just flopped down on the couch and just sat there, amazed that he'd done it. Proud but cautious, a new general pediatrician sews a toddler's face back together, and it worked. Now you would never know it happened, and he has never ever done another surgery like that again. Story 3. I work in gynecology and I had to chaperone a male doctor for a pelvic exam. Patient was complaining of pain and discharge. Her area was completely red and swollen. He then so gently inserted the speculum to get a look, and immediately a white cottage cheese-like substance comes pouring out onto his lap and hits the floor. Imagine dropping a container of cottage cheese on the floor. We stare in disbelief. He then had to remove the speculum and use it like a spoon to scoop out more discharge just so he could get a look inside. He tells her it's a yeast infection and she'll be good in no time with prescription medicine. That day I learned if you smile while humming, it helps in suppressing your gag reflex. Hopefully this is the grossest one just knocked out of the way. I'm so sorry to everyone who had to listen to that. Story 4. I was the patient, actually. I was sideswiped by a car, then ran over by the truck behind while cycling to work. I was essentially impaled by my right femur, which shattered my pelvis and shoved bone fragments into my guts. Last thing I remember before I got knocked out for surgery was the surgeon telling me everything was going to be fine and it was all routine. I didn't wake up for a month. When I did, I was missing the entire left leg and most of the muscle tissue in the right. I was too weak to move much, couldn't talk because I had a tube down my neck, and I was very uncertain about reality, due to what I went through during my coma. Parades of doctors came to tell me how I should be dead, and it's crazy that I lived. I was told over and over that my survival was pretty much against all odds. My surgeon, on the other hand, never said anything like that. He always maintained that he was going to get me through. His attitude honestly helped when I had to go back to his table a few more times before I was done. For 4 years, I kind of blew off the people who made a big deal about my survival. I adopted my orthopedic doctor's attitude. Then I met a woman who's in the medical field. I fell in love and eventually trusted her enough to let her read my medical records. I had never read them because it's just a massive pile of paperwork. She broke down crying and couldn't read anymore. She told me that the beginning of my time in the hospital was full of the type of write-ups you find in the morgue. She told me that when they opened me up, bits of my pelvis fell out. I asked her to stop there. She won't read anymore and I don't want to know anymore. I now know my doctor has one hell of a poker face. It's either one hell of a poker face or they were just very confident in their ability. Story 5. As a medical student doing my first placement in the emergency department, I was waiting outside the triage room to ask the nurse something. I was the lowest ranking, most clueless person in the department. I knew a lot about the Krebs cycle, not a whole lot about, medicine. A young man came up to me and said he was sorry to disturb me and he just wanted to check. It was just, not to queue jump or anything, but he wanted to check. Can this definitely wait for triage? He then unwrapped a towel from his hand and showed me his thumb, which he had dropped a loaded barbell onto. It was shattered, just flattened, with splinters of bone coming out. I stared at it, he stared at it, I stared at it. Then I told him, oh yes, no problem at all. He'd better take a seat and I would make sure someone was with him right away. Story 6. Lady came in with possible stroke symptoms. Numbness, weakness, difficulty speaking, Gale abnormalities. CT brain was unremarkable. Lab work was really odd. We were thinking cancer, so we decided to CT her chest and abdomen as well. Turns out she had a dissection the entire length of her abdominal aorta and going into her right femoral artery. Left femoral had an aneurysm and was beginning to dissect as well. She had formed a massive clot throughout her abdomen that was miraculously keeping her alive. Basically, all of her organs were ischemic, dead. About 5 different teams showed up in the ER to see her. After hours of discussion, the consensus was that there wasn't a damn thing anyone could do. We sent her to hospice. Story 7. 4th year med student here. On my ER rotation a couple months back, I walked into the ED and was immediately asked to help a nurse and resident put a catheter in a patient. Now, a catheter placement is usually a one-person job, so I was pretty confused as to why they needed my help. I walk into the patient room and I'm immediately greeted by a disgusting, rotting flesh smell. Worst thing I've smelled in my entire life. The patient has to be pushing 400 pounds and has the worst edema, soft tissue swelling, from congestive heart failure I've ever seen. His scrotum and dong foreskin are about the size of a small watermelon, and the foreskin had swollen completely over the tip of his dong. The nurse had a speculum inserted into the man's foreskin, while the resident took the catheter in a hemostat, pliers type thing, and jammed it into the man's pee hole for 20 minutes. They finally got the catheter in and took the speculum out. It was covered in a thick brown discharge that looked like fermented pee and crap. I still don't know how he let his general area swell that much. Remember when I said about the grossest one being out of the way? I was wrong, and I'm so sorry. Story 8. ER Tech here. A few months ago, we had an elderly gentleman come in presenting with shortness of breath. As I was getting him into the gown and hospital socks, I noticed very old, yellowing bandaging around his foot. I inquired to its purpose, and he told me it was a large wound on the back of his heel that wasn't getting better. I asked him if I could unwrap it to inspect it and possibly rewrap it. Basic wound care is one of my duties. And it was literally a hole in his heel about 4 centimeters in diameter. The skin was necrotic around the edges, and a large flap of skin was covering the middle. I wasn't terribly shocked until I swore I saw the skin flap writhe a little bit. I got the patient's consent to look under the skin flap, and sweet galactic Jesus, there were 3 sizable maggots just chilling. I've read about it before, but I have never seen it in person. My brain went, what in the solar hell? And despite my attempt at a poker face, the gentleman read my reaction and asked, is it that bad? I was straight up with him and told him that the wound had maggots and needed immediate treatment. And the poor guy started apologizing for bringing something disgusting. I told him, I see this more often than you think. Maggots are actually great at cleaning out dead tissue and are used as a treatment sometimes. He seemed relieved by that, but it was definitely my first time ever seeing a maggot-infested wound. Can I get something less gross for the next one, please? Please. Story 9. I'm an RN who specializes in wound care. A common occurrence is a pilonidal cyst, which is an abnormal growth in your gluteal cleft, aka butt crack, and it usually contains hair. It usually happens with younger people, say 13 to 20, and they are obviously very embarrassed by it. When we get them, they've already had the surgery to open and extract the cyst, so there are a few holes left that we have to heal. One poor soul came in who had the worst post-surgical hole I've ever seen. It was so big it extended from the top of her crack to the top of her anus, then out on either side about 12 centimeters. It was like the surgeon carved out most of her butt. The patient was devastated, and I tried to comfort her by telling her she's not the worst I've ever seen. Poor girl. Story 10. Lots of stories, many already covered by others. I will share this particular story with my legs crossed. Motorcyclist came in after someone left turned without checking. He had gone over the hood, slid, and somehow somersaulted, landing on his butt, sitting up. He slid across the intersection, mostly on his butt, getting serious road rash. Luckily, he was only a block from hospital and ambulance. They pack him up and bring him to the ER. We end up cutting off his chaps and jeans and begin the cleanup of gravel and sand embedded in his thighs and butt, when all of a sudden, his testes fall out. He had basically sandpapered a hole in his sack while skidding on his butt. The attending pauses, grabs the saline, irrigates the sack and nuts, fondles them back into places while humming. I handed him some gauze to pack the wound and smiled at the patient who was under a local anesthetic. Then I went on break, went fetal, and dry heaved. Story 11. I worked as a tech in the ER for a while, and I had a woman in her 40s present with burning and pain down below, discharge, and a bad smell. I got the cart set up for an exam. Got her vitals, blood, and urine. She couldn't pee because of all the pain, she said. All the basic jazz you do when someone comes into the ER. I processed my samples and let the nurse know everything had been done, and she goes to talk to the woman. And it essentially goes like this. No, she hasn't had any trauma. No assault. No, she doesn't know what's going on, but it all started about 3 weeks prior. Long story short, we got the doctor, as the woman refused to let the nurse take a look. And we're all in the room when the doctor turns on the light under the drape, and immediately asks if she's been using any medication down there. There's clearly a lot of irritation and swelling, as well as a very strong odor, and she hasn't even inserted the speculum yet. The woman says no, nothing. At this point, the nurse goes to get some saline, and I'm left to hand off tools and handle any swabs. The first swab handed to me was literally tinged a pale green, clearly infection. I'm capping it, and the woman smells the odor slowly filling the room, finally, and starts apologizing. I had to say, while trying not to gag, no need to apologize. I've seen much crazier things. Just relax, and we will get you all fixed up. Well, the nurse comes back with saline, and the doctor essentially starts flushing this woman's kitty out, trying to clear out all of this discharge and infection, just so she can see what's going on. And all of a sudden, she stops and asks if she is sure she hasn't put anything in there to treat any medical condition, even something not given out by a doctor. And that's when we find out for about a month, this woman had been douching with a bleach and water mix to try and cure a yeast infection, because she read that in hospitals we wash down with diluted bleach to kill germs and thought it would work. She was riddled with chemical burns and infection and was immediately transported to a bigger hospital. So yeah, that happened. Story 12. Paramedic here. Had a homeless guy call saying he'd stepped on a nail about a year ago. I could smell it from the door, so I expected it to be bad. But when I went to pick up the leg by his heel, there was just nothing there. His foot just evaporated into pus and maggots, and his metatarsals clinked through my fingers. While I'm standing there just trying to comprehend what happened, he just sighed and asked me to pick up his foot. What foot, buddy? He said, it falls off a lot these days, but it still hurts, so that's good, right? I had no clue what to tell him. The nurses thought it was hilarious that the baby medic, that's me, got grossed out. Story 13. Had a patient who needed a lower GI study to find/fix a bowel bleed. To get a study done, you need to poop clear mucus. 3 days we get bowel prepped with heavy laxatives and enemas. He barely pooped anything. He puts on the call light at 6:45, 15 minutes before my shift ends. He calmly says, I kinda want to try and poop. He said it so casually I figured he was going to toot out another gas bubble and walk back. He stood from the bed, took one step, and the floodgates burst. 3+ days of the most rancid, liquid stool I had ever encountered. It just wouldn't stop. He left a river from the bed to the bathroom, coated the walls as he bent to park his butt on the toilet, and continued to dump out 7 people worth of crap. In my 9 years, I have never seen that much come out of a person. He wasn't even a large man. He was so embarrassed, but I just kept my face as solid as possible. I grabbed half the linen closet and 3 packages of Cavi wipes and sopped it up. Told him that this happens all the time. Maybe it was just naive for me to hope for non-gross stories in this, right? I guess I was setting my expectations up for failure. But surely it can't get worse from here, right? Surely. Story 14. I used to do psychiatric evaluations in an emergency room setting. One time I'm evaluating this 60-year-old woman who is lying in the hospital bed. I'm asking her questions and she stops me and says, "Excuse me, but I need to pass some gas." I let her know that this is a medical setting and that is a completely normal body function and to not be embarrassed. People pass gas all the time. I was not prepared for what came next. She let it rip, and out came the loudest, wettest, and longest sounding fart I have ever heard. It was bubbly and juicy, hitting all the deep notes while ending on a squeaker. I don't think Satan could have made a noise like that with his anus. It sounded so relieving, but then the smell hit. It was bad enough that I started to gag and had to excuse myself from the room. When I came back, I politely asked if she needed a nurse for anything in case she needed to be, cleaned up after that, but she declined. Obviously, I've witnessed people farting before, but I have never heard or smelled anything like that. That was something else. Story 15. Nursing corrections here. Had an inmate/patient come in with complaints about severe lower abdominal pain. He told me that he had stuck something in his prison pocket. Before I could ask him what he stuck up there, he bends over and shows me a cord sticking out. I told him, "Don't trip, I'm sure the doctor can help you out with that, you'll be alright." Come to find out, the prong of the phone charger got caught up in something and it was stuck. As I was trying to comfort him, I started to hear this vibrating sound. So I asked him if he heard it too. He said, "Is the phone inside me that's stuck with the charger?" It wasn't just a regular flip phone either. It was one of those Samsung smartphones. I bet this guy thought he was being so smart. He's like, got the cord in case it gets stuck? I'm a genius. Oh no, the cord got stuck too. That's rough, buddy. Story 16. Young man, 18, apparently comes in about something else, trying to work up the courage. Right before he should actually be leaving, this can be really annoying if there are people waiting, he says, "I need your advice. I'm banging my mother." What do I say? Oh my god? No, I didn't. I said, "This isn't the first time someone has told me this." That wasn't true. Turns out he knew that it was wrong and that his mother had initiated it. He was trying to extricate himself, and he was desperate for help. But the thought that someone else had been in his position meant to him that he hadn't been judged, that he wasn't doomed or would go to hell, and that there was hope. But he didn't know what to do because the person to whom he should have looked for advice was actually his abuser. But the lie helped diffuse the situation. Story 17. I had to have my leg rebuilt after a car accident and was eventually sent to Duke University for my surgery. My surgeon was supposed to be like the best orthopedic surgeon in the country. I think he used to work for the Baltimore Ravens. Anyway, all the doctors from my hospital at home were very unsure if I would even have a functioning leg, let alone walk normally again. The first appointment at Duke, the dude told me it was really not a big deal, and he would have me fixed as good as new. I honestly thought he was just trying to be nice and optimistic, but he was very serious. 5 months later, I was walking and learning how to run again. He said I was one of the most complicated surgeries he has had to do, and a group of surgeons flew in to observe him do it. That's how you know when something is special with you medically, when you become a learning moment. Story 18. I'm the patient here, and the nurses didn't even try to say they'd seen it before, but it still fits. When I was getting treated for cancer, I got a really bad case of pneumonia and had to be intubated and put into a semi-coma type deal. I don't remember anything that happened in those 6 days, but I was apparently made sober enough to open my eyes for visitors every day. So I don't know if that counts as a coma. It was some pretty serious pneumonia, because it was like less than 2 days between my first cough and them making the call that I would need to be intubated to stop me from drowning in my own fluids. So they didn't mess around and gave me a ton of antibiotics. You know how some hospital beds have a track along the ceiling that can hang IV bags from? I had enough antibiotics hanging from mine that it broke and fell to the floor. Again, I have no memory of this, though. But the thing that was truly unprecedented occurred when they were changing out my butt bag. I don't fully understand what it was, but they had to put something on or under my butt that collected all of my bowel movements. They put it on after I was heavily sedated and removed it before I was totally awake, so I don't remember it. For anyone who doesn't know, antibiotics can cause a lot of diarrhea. Apparently, when they rolled me on my side that day, I let loose a fire hose. It arced through the air across the room and splattered all over the door and window, which were about 12 feet away from my bed. I think it's super cool and funny, so they didn't have to pretend like it was normal to comfort me. Story 19. Medical student here. Had a first-time mother who was having difficulty nursing because her nipples were chafing pretty bad from the baby teeth / constant moisture to the area. Before showing me and her OBGYN the problem, she apologized that I had to see it, since I'm male, but I told her I've seen plenty before, especially in the ER. While not the worst thing I've seen, a gunshot to the head takes the cake there. I don't think I've ever seen skin so badly chafed before, and it looked like she had the beginnings of mastitis on one of her breasts, since it was red, warm, and very tender. The nipples themselves just looked raw and extremely painful. It's stuff like this that makes me wonder how the human species has made it this far. Childbirth, in so many ways, seems like a horrible experience, and then everything after that, too? How did we procreate enough without just getting eaten by everything around us? It's truly a mystery to me.